specialist in Newport Beach, California, and I am talking tonight about doing scars in different skin types. This particular patient, she's an Asian patient, and I want to talk a little bit about how I do scars in all skin types. In this case, for Asian patients, there's certain things that we're going to do to really make sure that we could do it safely and really still get excellent results. So I'll walk you through this process. We're sort of in the middle of this process. Really, this is more of a progress report. But I'll talk you through how I treat these scars and what I do really for patients to be able to get best results. Hi, Martin. Thanks for rejoining here. So that's what we're going to talk about tonight. And really what it involves is more manual work, things like subcision or TC across, things that are really going to break up the scar tissue, go at the depth of the scar without using high heat, high energy. That's the main thing that I like to do, because I really want to make sure that we can get excellent results without causing significant downtime or causing other issues really down the line for patients. So that's this overall process here that I'm going to walk you through, and just hopefully make you feel better about just this overall process, because I know that there's a lot of questions about how we do these treatments and whether or not these are safe and like how can we ensure that it's safe for you, which really, like, that's the number one thing, actually, really. It's more than like the result is just the safety issue. Thanks for rejoining, everybody. Sorry I had to log out and try again because there was some sort of issue that was happening, like technically. So I just wanted to see if that would fix it. And I think it may be fixing it, hopefully. Albut Noor is saying, texture on my skin got destroyed through electrolysis. What do you recommend to fix it? That's actually something I've seen multiple times. Sometimes it is more of these ice pick scars, and we have to do TC across a lot of times for those scars. Sometimes we have to do excisions. I'm not sure if you have if you do have ice pick scars. I have seen rolling scars as well, as well as boxcar scars, but usually it's more ice pick scars when it's due to electrolysis. Really sorry that happened. I mean, you were trying to do something that was just supposed to be like easier to help you out with hair, and ended up causing scars, which is really unfortunate. And it's something I see a lot of times, actually. It's kind of concerning, the fact that there's a lot of people out there that tout to be able, and claim that they could do electrolysis safely, and they're causing literally significant problems, and like it's really costly to fix the scars that could occur from these things. So I hope it wasn't too severe for you, but definitely I will try my best to help you out. Would Pico help with fine lines and minimal acne scars? Pretty minimal ones, yes. It would help with that. Also, it helps a little bit with your fine lines. It's true, actually. So it would help with that. Cologne Bop is saying, would this person need more treatments to see better results? Yes. So that when she came in this day, when we did this photo in October, we did some more Bellafill, a little bit more TCA. Her skin wasn't quite ready for more lasers, just quite yet, for like aggressive lasers. So I'm going to be pushing that back later on when she comes in. But yes, absolutely. This is more like a progress report. Expect really like this time next year, it's going to be a lot better. It's really early on right here. But it's nice. You could see like this journey, this process. This is a patient, East Asian patient. And, for her, these scars were really distressing. And it's like already we're seeing really, really nice improvement. I always say, though, that especially for certain skin types, certain ethnicities, we really do want to make sure we're very, very careful. So sometimes we're not going to be able to use the laser with as much heat and as much energy as I may be able to do with someone who's perhaps like Northern European, for example. Not this patient, but another patient, one of my Asian patients earlier, she was like, what Fitzpatrick am I? But it was actually interesting because she is like, she has almost appearance of no color in her skin, and she's of Korean origin. And I had worked on her before. She has no pigmentation issues whatsoever. And she's like, what Fitzpatrick am I? And the thing is that she doesn't fit this Fitzpatrick scale, because actually, if you look, she does have a little bits of hyperpigmentation on her arms, for example. She just does a really good job with sunblock, and like perpetually has always used sunblock. But she doesn't fit what's the traditional Fitzpatrick scale. Like I don't know why it hasn't been updated for Asian patients. But Fitzpatrick scale doesn't fit for Asian patients. you look at someone like this, and this particular patient as well, and this patient is actually a little bit darker than my other one, and someone will think that this person won't have a problem with certain lasers or energy devices because they're lighter skin type. And the truth is that actually Asian patients can get significant pigmentation issues. And sometimes you could actually get worse scarring with it too. A lot of times you do see a prolonged redness in Asian patients as well. So especially, East Asian. When I'm talking about Asian, I mean more East Asian. So I'm thinking more Vietnamese, Korean, Chinese, Japanese, a lot more with that. Sometimes, I know we would consider it with Filipino patients, but there's a little bit difference with the Filipino patients as general. I do find that sometimes the skin is a little bit thicker, sometimes a little bit more oily. So I do always want to control that oil really robustly a lot of times before I do these treatments. So ethnicity does factor into a lot of these things too. And just what I feel like the skin, the thickness of it, it's really important sometimes for me to know, because some ethnicities do just have very, very thick skin and do have a little bit more oil production. So it's good for me to know that so that I can sort of tailor as I'm working on this to see how I can achieve the best possible results in, as short of a time as possible for you. Lipsis is saying, so what is truly the best way to get rid of acne scarring? It depends on what kind of scars. What kind of scars do you think you have? Is it like this, or what kind is this? What size of cannula do you usually use for subcisions? Anywhere from 18 to 22 gauge typically, but sometimes like today I used 2 cases. I used a Noker needle, and then 1 case I did a Tailor Liberator today. I was actually, thinking I was going to use Tailor Liberator for 2 of those cases, but I ended up only needing it for 1 case actually. So interesting. Basically what I did is I go in there and I break up the scar tissue really carefully with the blunt cannula. I'm just constantly trying as much as I could to break up each individual tethered bond. And then if it's really stuck, then I'll use potentially, if it's like more superficial, then I may just use a Noker needle to try to break up. That's like this blade. It's almost like a razor blade that I go underneath the skin and I break up that scar tissue better. But sometimes it's still really stuck, or it's a little bit more, it's a little bit deeper and like more intradermal. And now I will use what's called the Tailor Liberator to really break it up even more. So it all depends, and a lot of times it's about blunt cannula, but if we need to, we'll use the different tools to really break up that scar tissue effectively. Because it's an invasive procedure, I really want to do it just under a single session. That's my goal, just to do it really properly, do it really, really effectively under a single session. Does the treatment TCA work for ice pick scars? Yes, absolutely. It will help in the right kind of scars. Just depends on the concentration of the acid that you're using. You don't want to use too high of concentration for more superficial scars. You really want to change it up, mix it up for patients so that you don't end up causing either excess scar widening or pigmentation issues. It really could be a problem. I had a patient a few weeks ago who went to a dermatologist in the LA area, and she had huge track marks of a burn that they caused from TCA that was applied inappropriately. At another patient, the dermatologist had blown air while they were doing the TCA, and it turned out they were using like 90% TCA on each of those scars. So it's that's why you're going to run into problems. And so that's why I'm a big believer in adjusting the concentration depending on the depth of the scar. It's not really all like just the same size. I know I missed a few questions, so I'll try to repeat those. So tretinoin, does it help with scars? It'll help a little bit with certain aspects of the scar. It will essentially help with the oil production that causes scars, or I should say that makes sometimes the scars appear a little bit wider. And so as you reduce and normalize that oil, you can see the diameter of the scars improve a little bit. It could give a little bit of collagen response then when you do that as well, so then your scars can improve a little bit from that. But I would really say that, like for someone like this patient, for example, really not going to help too much. She was doing tretinoin before in the past also. She did multiple microneedling sessions, and I believe Fraxel lasers as well. Didn't really help her at all, she said. So that's where something like this really helped, improved the scars a lot. It was with subcision, TCA cross. That's how we could do it. Do you treat HS scars by any chance? How would treatment look for that HS patient? HS, a lot of times what we do is we're still with a little bit of laser, but we may need something like Bellafill. I do find that there's a little bit more volume loss there. Can we revisit briefly where certain ethnicities get different outcomes? Yeah, good question. I mean, it's not necessarily that the end result is different, but I do think that certain ethnicities do get a more robust collagen response. That patient I was referring to earlier, who was asking about her Fitzpatrick, she is Korean, a patient, and I think it's like probably 4 months out since I did her treatment. She had ice pick scars and boxcar scars, not too deep, it was relatively superficial, but still they were there. And most of her lateral scars are gone almost completely. She has a little bits of ice pick scars in the mid cheek. And that's like really rapid, like very, very rapid. And it's something I see a lot with Korean women. It's just like they sometimes just have the most robust collagen response. So interestingly enough, but there's another aspect though with the whole thing, which I always kind of talk to. Well, I shouldn't say always. Not every patient, I have that sense from, but some patients, especially certain ethnicities or within certain circles, social circles, they get a lot of pressure to have like perfect skin. And they always ask me if they could achieve that perfect skin. Actually, one of my long-term patients yesterday, her skin looks beautiful, incredible skin. And she is, she's ethnically Korean. It's beautiful now. She had scarring, but she does have still some scars. And it's like she's so bothered and disturbed by it, and she wants to get like perfect crystal clear skin and this glass skin look. And some of these scars are just not going to get there. Like we can get kind of close, sometimes depending on how deep it is. But it's there's a point where we're just not going to be able to achieve it, and it's just really important just to just not even expect it that way. So don't think in terms of I want glass skin. Think in terms, I want to actually just feel better about my skin. I want it so that people are not going to be noticing the scars much. I want it so that when I wake up, I don't feel like I see the scars much. When I wash my face at nighttime, I don't see the scars much. That's achievable. That's something that we should be able to achieve, even if they're very, very severe scars. I mean, give me enough time, I should be able to get to that level and get to that point. That is something that we could get to. It's not something I'm going to promise, though, to be able to achieve glass skin. And I think it's really, really important just to drop that whole concept of glass skin. Everybody has a little bit of texture. Everybody has some breakout here and there or some issue that comes up, and it's okay. It's normal. A little bit of oil production here or there or something like that. And it's like, and you can't really compete with each individual thing. Like when I was at the Billie Eilish concert yesterday, I was like, well, there's just like nothing you could do within this thing. She's pretty much like, in my mind, one of the greatest who's ever done it, really. And it's like, I'm looking at it, it's like, there's just like the amount of creativity that comes in there, the amount of skill, and then it's like she's got her brother involved too. And it's awesome. It's awesome that she could do it. I think it's just awesome that we could just appreciate that. Just appreciate that if you find that there are people out there with perfect glass skin and you have scars, just appreciate the fact that exists. That's awesome. And it's really cool that they have that for them. Be happy for them because it's like it's really nice. But just accept that like that's that's possible for you. It's okay. You have other things that you could be really, really happy and excited about. What we're trying to do is just kind of shift this kind of burden, this stress, and make it so that you're not as worried about this anymore. And we can get there. I just want to emphasize though, it's not going to get like glass though. It's not going to be perfect when you have scars. This patient is never going to have glass skin. She's never going to have it. Never going to have glass skin. She knows it. I know it. Sometimes she did ask last time about trying to get closer to that. How long would it take for her to get to that? Can we get better and better and better? Yes, but is it going to be completely smooth? No. And you shouldn't be doing this because you think that it's important for other people to notice that your skin is glass skin. It's just like for yourself, you should be happy that like there's less visible trauma on your face. And that's what this was. This was trauma that happened when you were 16 years old, 19 years old. And I'm trying to make it so it's less visible for you. So it doesn't bother you. It doesn't affect your day-to-day life. That's what we're trying to achieve here. And it's achievable. That is achievable. That's what this is all about. That's like everything right there. And I want that to be like everybody's mind when you're doing these treatments. Just recognize that like I'm trying to get it so that this is less visible, and this is something that where even if you were really close, it has to be under certain lighting. That'll be really cool for a lot of patients. That's achievable too. It really has to be under really harsh lighting. But I don't want you to get like depressed because you go to a changing room and now it's like really terrible lighting and you see your scars again. Like I just don't want that anymore. Like I want it so that you just accept that okay, there's a little bit of texture. Day to day, it's not like that. Day to day, people aren't noticing that. It's okay to have a little bit of texture. We've accepted that we're not going to have glass skin. You've already moved on from that. You're trying to achieve just the best possible version of what we could do with your skin. Cool. How do I get rid of red spots? I do, well, it depends. If it's just mild, you could do azelaic acid, works well. You could also do XLV. XLV works well, or something like V-Beam could help as well. Oily skin, after 1 or 2 hours, I have to blot my face with a tissue and have scarring by my hairline. Well, if it's oily, you may just want to just introduce some sort of retinoid. The easiest thing to do is just to get over-the-counter differing cream or adapalene, and then essentially what you do is you try for a couple weeks with a little bit of moisturizer afterwards, and then drop the moisturizer, like a moisturizer like Vanity cream especially, and then drop the Vanity cream and just continue that different gel. But if it's still really like resistant and it's really frustrating with oily skin, you could do like a low dose of isotretinoin potentially, or even like something like the Cure Laser could help as well. So all those, there could be options there. It just depends on how oily it is and what you've already tried before. So Zeke is saying mine were too, just on my temples and cheeks were deep wash. So temples, that, and this is what I did for this patient also, is a little bit of Belafol. Works incredibly well for the temples. We just have to go slow. We got to go slow with the Belafol. You can't just like shove a bunch of it at one time. That's one thing that I wanted to emphasize for people too. There's like this aspect that everybody has where they do Belafol, like they're really happy for like a month or so. Then it goes down. They think that's just gone. And it's not the case. The thing, it's not. It actually triggers your body to make collagen now. And it's like a slow process now where you start to feel like your scars are getting better again. But it happens, and it always happens. And it's really cool. But it's so confusing for people because they're assuming that it's just like, they assume that it's just a traditional filler. They assume that's just hyaluronic acid filler, which is drew in water, and then once it's gone, it's gone. But it's not like that. It's making the skin itself better. So that's why I do so much Belafol on my own face, because it de-aged me. It was like the thing that just helped a ton for me. It was like the thing that I found I needed to do something for collagen production. I needed to do something for volume. And like, what was I going to do? That's the thing. It's like, it's so funny. Like there's so much, and it's so funny actually. I just have to say this part. Like I talk about how it's important to do things for yourself. But there is another side of the token, which is that there's so much societal expectation, which we just have to accept, really, because those are sort of like the rules of the game, that people do just judge a lot of people. They judge people based on their faces. They judge people based on their weight, if they're overweight, underweight, if they have too many wrinkles at a certain age, if they have scars, they think that they picked on the scars. All those things are kind of coming into there. So of course we want to educate people, do things like that. But we also do want to look the best because we do know that that's the real world. We know that like people do judge people. And I was getting tired, myself, of so many people that were just constantly saying I lost so much weight. I did lose a lot of weight. I was super busy. I was having I had a baby. First I was on the way. I was doing a lot of work. And then I had the baby and it was like a lot of work. And of course it's like, it's awesome, but like I don't have that much weight to like give. And so when I lose weight, it's like I become super gaunt. And so what do you do with that then? If I lose a lot of weight, lose a lot of volume, and now I just look at myself and it doesn't look like myself anymore, you can't do fat transfer. So it's like, what are you going to do? I didn't want to do hyaluronic acid filler because I just didn't like the look of it. I thought that not so much, I think I should say, let me clarify this. I didn't really necessarily trust too many people injecting with hyaluronic acid. I also found that it was just too short acting, even if I did find someone who was really good for it. So I was like, I want something long lasting. I want something that's going to improve my skin also. And I want something that's going to look super natural. Those are things that are really important to me. And that's why I went to collagen stimulating products, and that's how I fell in love with Belafol. Honestly, that's like the story of me like finding Belafol, because it's like I don't have fat, so how am I going to do a fat transfer if I don't have any fat? And it's like I didn't want to do hyaluronic acid filler, so it's like what's the other options then? And I think that it's like all these people that act like, oh, just like love yourself only and like just only do that, and it's like cool, like do that, you do that. And I do still love myself. I was still happy with myself. I had a great life still. But I also was like looking at it like I also just like have a certain vision of myself. I have like certain like expectation of what I looked like when I was 20 years old. Granted, I knew I was in my 30s. I didn't expect to like look back to 20, but I just wanted to look like healthier again. I want to look more like myself again, look like myself that I used to have, like some more volume, and like it was just like obvious that I didn't have that anymore. I didn't have like this glow anymore, and like didn't have that fullness. And so I was like, I just want to go back to that. It's like, is that really like a crime that you want to do that? Is that really something terrible that you want to just like make yourself like feel better and look like yourself? I wasn't trying to change myself. I just wanted to just look like just like I was myself when I was younger. And I was really happy with the way I looked there. So I was like, I want to go back to that a little bit there. I mean, and so it's like, there you go. There's the product that I could use. And it's just like little bits of Belafil slowly over time. Helped a ton. But I'm not saying you have to do Belafil, but just like think about that if there's volume loss, you gotta do something. So Sculptra, Radius, Belafil, all good options. Fat transfer, all good options when you have volume loss. So consider it really strongly if you have volume loss, you gotta do something. What do you think of Peak Away for acne, PIE, and PIH? It's okay for PIH, a little bit, not going to help too much for PIE, but it can help for PIH though, for sure. Is thulium fractional laser a good choice for acne scars? No, it's not. It's really, really mild. It can help a little bit for pigmentation depending on your skin type, but not going to help too much. Hi, Kimmy. How's it going? This was actually after 2 sessions at this point here. We did TCA cross. We did a laser. I did a ablative CO2 laser. I did fractionated CO2 laser, erbium laser. Also, I did subcision in this patient. And then we also did some Belafil as well in the temples. And then when she came back, I did a little bit more TCA cross. And then I believe a little bit more Belafil that day as well. Let's see here. Giuliano saying, Dr. Qazi, my doctor overshot radius filler. Now I have 2 lumps on my cheek. Are they going away over time on its own, or do I need to do something? Is it superficial? Is it deep? When did you get it done? Because a lot of that is really potentially just absorbable. If it's just like a matter of a few days, it's like just a little bit swelling. But if it's longer than that, we should figure out what to do with it then, if there's much to do. How often should the Belafil be done? So basically, I try to do it more towards like eventually as we get like that fuller correction. Then you may just do like little tweaks here and there. If you have aging or losing your natural fat pads, you may put a little bit here and there, or work on balancing the other parts of the face. But once it gets like pretty close to full correction, you don't have to really touch much at all. It's just like you don't really have to do much. Like my mid cheek, I don't touch at all. I don't really do anything like that. So it's I haven't done it in years actually in the mid cheek area. I just haven't needed to. So it's like just there. It's just like it's like exactly where I want to. I never want to overdo it there, and so I just keep it that way, and it's cool. It's like it's great because even though sometimes my weight does fluctuate a little bit, like I work a ton and miss lunch or breakfast, usually both, and then I usually just eat like dinner, and I don't eat like carbs at nighttime. I don't eat much sugar at all. I've actually cut back a ton on sugar, like in August, actually, when my birthday was. So I was like, sometimes my weight just fluctuates because I'm just like running around, and it's fine. And at least I have something that's always going to support my face, support my scars. It's like always going to be there. And it's really cool to have that. It's like I always have some sort of buffer. So even if I get like hollowed out from just like losing weight, I still have it there. All my patients this last couple of weeks were saying that I lost a ton more weight. I don't know if I did. I don't know if I did, but I'm always like working and like running around. So just that loses a little bit there. And plus I go to the gym now. Microneedling, so that's not going to help too much, especially for these kind of scars. This patient did a lot of microneedling actually. She didn't help much at all. Oh, hi, Erie. How's it going? Hope you're doing well too. Good seeing you on. Can microneedling cause breakouts? Yeah, sometimes it could cause breakouts. It depends on if there's a little bit of bacteria on the surface of the skin. It could potentially do that actually. First of all, make sure it's really, really clean. And just in general, just kind of see what you're doing the microneedling for. I wouldn't recommend it for scars. It's going to help a little bit with texture, but it probably would not help with that. And you can take a look also see what kind of glide you're using for the microneedling. What about Fraxel laser? So I did 6 Fraxels. And mostly my scars were rolling scars and a little bit of box scars. And it did nothing for my scars, really. So, and I did microneedling as well. I did Fraxel and microneedling. I did that combination. It got sold in that package. And it did almost nothing for my scars. So that's why I don't push that stuff. That's why I don't really do it really at all. It's like Fraxel, it's okay. It's like it helps for a little bit of pigmentation, a little bit of texture, but it shouldn't be pushed at all for for scars. And so many people were saying that, it's the only way to do for darker skin types. Well, you could just do nothing, I guess, because clearly you shouldn't be doing it. If you just think Fraxel is going to be the best option for these darker skin types, you should just not do anything and just refer out. Like, a lot of the dermatologists in my area just refer out, but there's, dermatologists in Northern California, other states. I find actually, especially like in Texas areas for some reason, that they do a lot of sometimes like, either like not super helpful things, but sometimes like reckless things on patients that are skin of color too. And it's like really risky. And so it's, it's unfortunate. And, it'll be nice if they just sort of like recognize that this is not their world. This is not the thing that they could potentially be the best in that they could do. That's okay, really. Everybody has a thing. When I was like I said, I was like Billie Eilish yesterday. I realized that she's like one of the best in her world. She really is one of the best that she's out there, and it's like really impressive. I should watch her. It's like that's like the level that she has, the depth that she's doing is amazing. So whatever world you're in, just try to be the best at that, and like love it and enjoy it and do that. Like and try to achieve a higher and higher level. It's awesome for you. But like if you don't understand scars and don't treat scars, probably shouldn't even touch it. So like don't do too much of that. Don't like experiment on people. Don't like think that that's something you could do. It takes a lot of work. Like I said, my last patient at the end of the day, I got done with him just like an hour and a half ago or so, and maybe a little bit longer, but just a little, and it took me an hour just to do a subcision part. And sometimes it takes me faster, but I didn't expect it to be that thick. And it was like very complex, actually, very complex scars. He's an Asian patient, and I knew it can't just go burn down the scars. And it was very, very deep, thick rolling scars, very deep, thick rolling scars. And there were areas that you have to be very, very careful to prevent complications and prevent problems there. So you really go in each individual scar and you're breaking it up, and you're doing this over and over and over again. So unless the person you're going to has like this joy when they're doing that and enjoys doing that, and it's like still really fun and cathartic for me to do, then like you really shouldn't like go to that person probably for those kind of invasive procedures, to be honest with you. Like really. And that's what I saw. Like I saw this, and it was like a really interesting moment yesterday. I was watching Billie Eilish, and I realized that like she's a lot like me. Like I was watching her, and I was watching her sing, and she loves it actually. She's like really enjoying it. And it's exhausting. And it's like she's doing it, but you could tell she really, really likes doing it. She knows what's happening right there. She knows that like the crowd is loving it, and she's getting more and more exciting about that. And that's really cool. So it's like, that's who you should find for whatever treatment you're doing. And like, if you're doing like whatever it is, try to find someone who just like really enjoys doing that. Like, and just like knows that this is something really cool. This is going to be really, really nice. When you do it, you can see that enjoyment in their eyes, and you can see that process, and it's really interesting to see. So like, I think you should do that. Like you should watch someone like, and that's how you choose your practitioner, choose that whole thing. You're the best. Thank you so much, by the way. Appreciate you. And user74 saying, thanks for treating me so well earlier this week, Dr. Qazi. What did I do on you? Because your name, obviously, I can't tell from user74, but what did I do on you? Is La Roche-Posay, the Effaclar, and the Cycloplast, are they good? I haven't really ever found like anybody who loved it, to be honest with you. I know I did try a little bit of times for several patients. I just haven't really found anybody that like was like blown away by it this time. I don't know anybody that was, but if they are, cool. Acne scar revision. Oh, awesome. Thanks so much. Hopefully you're doing well. Hopefully you're healing okay. Oh, okay, perfect, Rachel. Thanks so much. Thanks for saying your name too, by the way. Appreciate you. Good thing you're doing well already. Very, very good. And, I know that we did it, and I think I already saw your photos. You're actually already like less redness today. I think I did remember seeing your photos today actually as well. So awesome. Really already pretty great. And you're doing a good job, by the way, of staying away from the sun, because that would have turned pigmented already. I know what I'm saying is if scars are minor, can you get rid of them, or do they just reduce the appearance of them? So that's what I was referring to. Like something like this, you're never going to be able to get perfect skin. It's just never going to happen. We're going to be able to reduce it. And we already are reducing it. But like, yes, she wants better and better results. We'll continue working on it, but we're never going to get perfection. Just accept that. Thoughts on sulfur bar soap? Awesome. I love it. Do it. Use sulfur wash. Sulfur is awesome. It just smells a little bit. That's the only problem. Awesome, Rachel. So glad you're doing well already. Really awesome. Really, really good. You're going to do it's going to be very, very good. It's pretty cool, honestly. It's really, really cool. I think it's like we could do all this, and and then at the end of this year, by the way, I am taking some time off, and it's just like, and then I just reset and just start the next year again. And it was just like this whole year I was doing this, and it was like, it's just really like, I was looking at it, And I guess I would say cathartic. I know I say it before, but like there's like this point where it's like you're doing it and you're seeing how many people you're working on, and you're talking to them for follow-ups, and you're doing all these things. And it's really, I would say, I guess it would just be that, like, I guess you're at peace with something, but I'm not sure what that word would exactly be. But like, you just find that like there's, like this purpose that you've achieved, and it's really cool to get there. And it's like this moment, and you're looking at it, and you're looking at everything that you've done, and that you worked on, and your team has done, and the growth of everybody. And it's like, we really have done really, really amazing things, life-changing things for patients. And we can continue to do it, and we're doing it safely. And it's like, wow, it's like a really, really good feeling, because I like wanted that when I was younger. I like wanted someone to be like that. I was like, just like so frustrated. I was so sad, actually. I was so sad in like teenage years. Like I would just like go to dermatologist after dermatologist, and it was like, just like, I just felt like they constantly were just pushing me away with like antibiotics for my acne and tretinoin and everything like that. And I was just like constant like cycle of that. And it was like months and months, and they didn't care what my symptoms were, anything like that. And then finally I got someone to agree to do Accutane, and it did work, but it was like really made me suffer, because I was on the wrestling team, and I was like doing all sorts of athletics and everything like that. And it was like, I had this Accutane that was like drying me up so much. And it was like, man, it was like tough. It was really tough. And I remember just like thinking to myself that there's got to be a better way with all this. And then after finally 3 rounds of Accutane, eventually my my scars were kind of bothering me, because I was like hanging around all these like fashion models all the time. That was my college, actually. I was like hanging around fashion models, actually, and who were like perfect skin. And it was like distressing me. It was like, I would think that they like everything was like obvious, especially, you go to like darker areas and stuff like that, and it felt like you could just see it. And it was like, man, this stinks. This is like terrible. This is annoying that like people could see my scars. And it's like, I wanted to do something. I wanted to improve it. And so it's like, I ended up like going and getting that done. And I was like, for 6 sessions, I did Fraxel laser and microneedling sessions, spent $3,000, and I hardly had any improvement on the scars. And it was like just sad. It was just like sad. And I really wanted to go to a thing where I could do that and improve that. And I was like, awesome, there I got it. Also, by the way, I see all your comments, and so if you're like cussing me out because I'm talking too much, honestly, I'm never going to treat you ever. I will never do it, and I will not give you advice, and like just like good luck in life, really. Because like here you are like cussing me out because like you want to get your answer, because like you're really selfish, and it's like really important. Really, you think that your comment is like worth like the hijacking the whole thread there and being rude to everybody. It's really unfortunate that like people are out there like that. I think like in this world, some people do sometimes get twisted like that. Some people get positivity, and some people do that, and so it's really unfortunate. So it's like I will talk however I want to talk on here, and like just say whatever I want to do, and you're free to come on, free to not come on, like, and just like enjoy yourself. I think that we have an amazing community, though. I really do. But like really, it's like sometimes I am just going to go in divergence and think about things and like just go with that. I'm not like just like going to sit here and like just like push a bunch of stuff and like, here's my skincare line, guys. I'm going to go talk about like my skincare and like just go push a bunch of skincare products, and people, hey guys, let me go talk about my like 12-step program for how I solved my skin with like these products that I happen to sell for $3,000. So it's like, I'm not doing any of that stuff. I'm just going to just talk about like this world and talk about the things that like, I think like a lot of people go through. A lot of people go through like isolation and like loneliness, and sometimes things like this cause it. So it's like, it stinks. And so it's like, I think it'd be nice to fix that. It would be really nice, whatever world you're in, to do that. How do I fix hormonal acne? Well, sometimes you want to double check, first of all, if you're on some sort of contraception, just make sure that it's something with estrogen and progesterone. So something like Yas pill. Sometimes IUDs are not great options because they may only have a single hormone, and then that could cause your acne. That's not the case, and you could consider doing something like spironolactone, and then plus or minus some tretinoin and antibiotics. Topical antibiotics, especially useful for that, especially for like that time of month. And thanks to everybody else, by the way. I know it's just like 1 or 2 people, but like I'm just saying, it was just like kind of like looking at this, like they're going on and on. It was just drink extra water. Water is awesome. Yeah, of course. Do water. Diet plays a huge role. Reducing your dairy intake, for example, things like that, huge things. Other inflammatory, dietary products, sometimes sugar for patients, things like that could cause it. But like, it just depends on what you have for your oil production. If it's not too much oil production, then I'm not sure if diet's necessarily going to change everything. Really, it's like hopefully put on future things, but it's not going to really necessarily trigger as much collagen probably as people think. I think just using normal everyday type of multivitamin, doing that kind of stuff is enough. Most of my patients, like this patient for example, she has a great response. They don't take collagen supplements. They don't do extra things like that. So I'm not so sure if it's something I should really necessarily push. I did my laser on Saturday, by the way. And I tested some exosome because you guys have been asking about exosomes all the time. So I tested it. I don't know if it necessarily changed too much. I thought it stung a little bit there. I don't know, and I was thinking to myself, man, I should have done like a half side, one way, half side, another way to really tell. So next time I'll have to do it that way. But I was trying the exosomes and it's just so expensive for patients and stuff like that. I tried it out and it was like stung like immediately afterwards. It like really burned actually. And I was like, I don't know if this is really necessary. I don't know. And like, I got the same same amount of downtime and like I'm not sure if it really changed anything really. So that's why I'm still not like pushing like exosomes on anybody or anything like that. I'm like, you guys decide. I'll try it again when I do laser again. I'll try to see if I could do exosomes on like one side of my face or the other side of the face. But like right now at this point, I don't know if I could really say that that's going to change too much. Would Accutane work on 20-year-old ice pick scars? It will help reduce the diameter of the scars. Yes, it can help a little bit with that. Let's hear Deepka saying that she has a consultation with me in February. Awesome, Deepka. Thank you. Do you have earlier availability? I don't think so. I think we're further out now at this point. But you could always go on our wait list for cancellations, and then we could see if we could see you sooner than that. We do have to take preference for patients who are already patients, though, like always. So we have to have slots for them always to be able to do follow-ups, anything else that's needed. So, it's... it may be tough. So just try to stick with your current one and then see if you can go on the wait list. Does HA filler for acne scars permanent? Well, if you do it multiple times, there may be a little bit of a permanent effect. Sometimes that seems to happen, but I certainly wouldn't call it permanent. It doesn't really change also the skin itself. Manuel is saying, how much will a treatment cost? It's usually about $5,000 to $7,000, but depends on how much volume loss there is and what we have to do with that. It could be more depending on the volume. A phenol peel, yes, for Fitzpatrick 1 through 4 for deeper, thicker rolling scars is really good for that. Don't think it's as effective for ice pick scars if they're deep. I also don't think it's super effective in certain patients without doing other treatments such as like subcision or something like volume, for example, which a lot of those more severe cases have. So there's probably multiple different things you have to do. Doctor, is melasma common like on the upper shoulder blade, or what can it be? It's usually more post-inflammatory hyperpigmentation in that area, we likely will have to do something with like a pico laser plus or minus some topical creams that could potentially help you out there. So usually though, like something like the pico layer. What's good for PIE? So azelaic acid. Azelaic acid looks really, really well for PIE. But if it's more stuck, then you may want to do something like the XLV laser or V-beam. Those are all good options there. Let's see where we are. I miss so many people here on this. I know. So just feel free to repeat it. Just like bear with me. I'm trying to get to everybody. One thing in life I would really, really like in this world is for people just to not be angry anymore. I want people just to have more patience and just more acceptance of everybody. So it's like, and that's totally what we could absolutely do. Just like be like respectful of anybody who's like in front of you or anything like that for the questions. I'll try to get to as many as I could, honestly. I really do. Shiva's saying, do scars really get better? I mean, I've had 6 sessions of non-ablative laser. Shiva, I did the same thing with it that way, like where that's what I was talking about earlier. I did 6 sessions of Fraxel laser. It did nothing for my scars really. So, you'd likely need something else that is probably going to be more manual work, like rolling scars need subcision, ice pick scars need TCA cross. That's probably going to be the best option there. Photona 4D laser. I haven't tried it myself. I've heard good things about it though. I've heard good things. I'm open to trying it out. It seems like it's a good technology because it's got a small handpiece for an erbium laser, which is really cool. But beyond that, I don't know much more about it though in terms of for myself. Other people have been really happy with it though in this world, and they say that it's been pretty nice for them. But it's still an erbium laser, and sometimes you do need more of a ablative CO2 laser. Christina's saying, what's a good treatment for ice pick and or boxcar scars? Ice pick is more of a TCA cross or excision. Boxcar scars, you could do a little bit of Bellafill underneath there to help undermine that, pop it up there, and support the scar. That works out really well. Thank you so much, Christy, by the way. I appreciate you too. Thank you. Is microneedling going to help with dark spots? No. I will hope that everybody knows that so nobody gets tricked by that. How's a carbon peel for very minor acne and scarring? We use a carbon peel at our practice, but we do it for really more for like mild texture, and then also for just like mild pigmentation. I would never say that's good for scarring, to be honest with you. And I appreciate all of you guys, by the way. Thank you so much for that. Yeah, I mean, I hope that like this stuff, at least, I know there's a lot of people that are further away. I know that a lot of the stuff that I do is out of patients' budgets, but at least you guys could get certain things out of this, which is that like certain treatments are ineffective for scars, and people shouldn't recommend them. Certain people shouldn't be doing doing treatments on you, and that's like for anything. Just take that for everything. Like that, certain practitioners should not be doing certain treatments on you, and that's just the truth. And it's like, just be aware of that. Just pay attention to that a little bit more, and also just sort of recognize that there's red flags out there. If I was telling someone the other day that she did 8 microneedling sessions, something like that. And I was like, man, if microneedling did help for these kind of scars, why would I not be doing it all day long? I would just have every room full, of microneedling devices, and like anybody could do it. Like my, nurses, PAs, everybody could just be running around all day. It'll just be like a microneedling factory. Why would we not? If we're solving scars with just microneedling pens, like of course you would do that. Like why would we not, right? Clearly, it doesn't work, and it just doesn't help. Like that's the thing. That's the truth. It just clearly doesn't work. I've done it myself on my own face. Didn't work for my face. Didn't work for my scars. And I want you to know that there's so many of my patients that have done it as well, and it didn't help for their scars. So really think of it as something that you should be more skeptical of. And that's with radio frequency microneedling. That's with the pen microneedling. You got to be pretty skeptical of anybody who's pushing microneedling on you for scars. It's really, really mild scars. Okay, maybe give it a shot. I guess that's probably fine. But like if you have scars like this, if it's thicker, deeper scars, and just think about that. And then if they really are pushing it, they are saying that's microneedling, and you're like, man, maybe you're really superficial. Maybe just talk to someone else or ask me or something like that. If your kind of scars, would it make sense to do it? And I hope that's something that you get out of this, because I hope that you don't have that feeling that I have when I was in college and I wasted like $3,000 and I was like burnt for 6 times with the Fraxel laser. I literally was like, it felt like someone just rubbed asphalt on my face, and it was like wild. And then like it looked great for like a week, and then it would go down, and it was like just distressing for me. And then I lost $3,000 as a college kid, just like as a 4th-year college student. And I was like, man, this sucks. And it was like really obvious too, because I used to kind of hanging out with friends, stuff like that. And my face was bright red for a week, 6 times a year. And I was like, man, after all that stress, I didn't have improvement. I did Fraxel, and I also did some microneedling. So it's wild. It's wild that you go through that. So I hope nobody else has to go through that. Like really. Because it's like in my time, that's what they were told. That's what they told me. That's what the dermatologist was saying. That's just like, oh, Fraxel, there's not many things you could do, but I could do Fraxel in darker skin types. But it wasn't that like Fraxel was made for that. It wasn't that it was like gonna help enough for these scars. It wasn't. The best thing. I would rather probably just save my money, like that $3,000, and put it towards something else in life. because I would have been probably a lot happier with that. I just wouldn't have had that annoyance that I had, and like that sadness that like, and the emotional toll that it took on me, where I was going up and down like that. I just hope nobody has to go through that, like I hope nobody has to feel that way. And that's really, really critically important. Like really, I go through this process with everybody, and I really do like just push it to you to see if we could get really, really good results. I will make sure that you do your sunblock, make sure you quit smoking, make sure your oil production is under control, and like do all the things that I could possibly control so we can maximize results. And then when I'm doing it, I'm giving you your full attention, and I'll try to help you to maximize the collagen response afterwards. So it's like I will try to get there, but if there's like areas that we need to figure out, future sessions are 55% off at this point. Future sessions for TCA, for laser, that's how you know I'm like putting a maximum effort that day. I'm doing it. Like I'm making sure that like it is like I'm knocking it out every single time. And even if it's like just a few spots there, someone else, actually, it's interesting. Every patient knows about this about me, that I'm very, very precise as I'm doing these things, like that subcision. I'm just very precise at each area that I'm doing it on. And it's like, that's how I'm doing it safely. Because you may go to somebody who thinks that they could do this or thinks that they could do it cheaply and things like that. And now they're doing something that's more reckless now. Now they're going through this and really burning through the skin with certain lasers, things like that. And they could run into a lot more problems that way. Charlie's asking, why do you think a cure is not effective in some patients? Interesting question, Charlie. Actually, it's a really, really good point. I have found that some patients had needed a 5th session. It's a very, very small amount, though. I think I have to double check our end of the year report now, but it's less than 5 people out of several hundred now at this point. I think we've done maybe like 1,200 or so treatments at this point. So quite a bit, actually. And probably about 5 patients or so have needed a 5th session, which I was surprised by. It's true. I did. And actually, I took care of it because I looked at it like, I wanted that there's a certain point that it should be like, that's like less oil. And I was pretty sure that at this point, it should be less oil. And I don't know if you guys know this about me, actually. I will just say this out there, but like I expect patients to be honest. I will be honest with you. And so I was looking at this like, at this 3-month mark, just seemed like there wasn't enough oil production that was reduced here. And there's still, it's not so much that there was bacteria or acne. That's not that big of a problem because we could control the bacteria. We could wipe out some of the bacteria. But I didn't love the fact that there was still so much oil at this point because all these other patients were cleared. And I did it. I took care of it for them. We did another 5th session for them. And now it's fine. I took care of it. So sometimes it just needs a little bit more. Some other patients, though, to be totally honest with you, they were doing other treatments, the other things, like sometimes they just weren't honest with certain things. And they were doing, facials sometimes. They were still smoking and things like this that were causing more oil production too, by the way. And then also they were just using less harsher chemicals on their face. And it really, that ended up overly drying their skin. And when it got overly dry, they had a rebound effect of more oil production afterwards. So those are the things that, occasionally happen, but everybody's been solved at this point with those, with 5 sessions, actually. I haven't had anybody who's now lagging and saying that, we did a 5th session here at this point right now today, at least. So that's good. So I can't say that there's somebody that just like hasn't worked like that. I think that just sometimes just means we have to adjust a few things, wipe out the bacteria a little bit, and before I completely call it quits. But if I have to call it quits for like 1 or 2 patients and say that there was a failure, like I said, I failed an Accutane 2 times. So it was my 3rd time that ended up working. But Accutane did fail for me. I don't know why I failed that badly. I knew like I had oily skin. I was a wrestler. I was working a lot, like running around a ton. I did a very, very oily skin, but like I don't know why it failed. I don't know why. I did take it. Ryan is asking, how long does it take for the redness to go away after Accutane? I am on my last month. Just moisturize a ton. It may take 3 to 6 months afterwards though. Is there any way to get to the right of the skin to photo to perfectly smooth again? Not perfectly smooth, but yes, we could continue to get this better. If we were able to follow along with this journey, a year and a half from now, it is going to be better. It's going to be like just a lot better. It's going to be just what we see right now. If you're happy with this now, imagine later on, it's going to be amazing. Dave is saying, I lost 60 pounds and scheduled CO2 around my eyes next month. Awesome. Look forward to helping out with that, David. I will absolutely try to help you with that. I'm going a little bit overboard tonight because I was at Billie Eilish last night, so I'm helping out there. Monarch Laser Guy. Monarch Laser Guy is asking, what about cherry angioma on the face? How would you go about it? I use the XLV. I don't know if you know Chris over there, Monarch Laser Guy. I don't think he still works there anymore. He retired. Chris was a really, really great rep, though. Actually, he's a really, really good guy. And he's one of those people that, like, he helped me when I was first starting. But, you know, it's just like, he actually, very interesting, actually. Chris, you should say hello to Chris for me, by the way. Monarch Laser is actually this company that I didn't actually end up getting anything from you guys, really, except for like some PRP kits and stuff like that. But you guys wanted me to get some devices and stuff. But I really, really liked the fact that like Chris would come by. I was just like opening my private practice, and he was like helping out the staff like kind of a lot with like just training and like just like explaining things. And it was my first time. Like I knew how to say things for myself in a way, but I didn't know like necessarily until Chris was like kind of talking to them. Like there's a different way of like explaining to staff and things like that. And he was doing it. It was like really cool. And he helped like just on his own, you know, and he was somebody I was getting PRP from. It's like, he just liked doing that. He liked teaching people. It was really cool to see. Really good guy. So that's what I like too. Those are the kind of people I gravitate to. Where can I get acne scar treatment after Accutane? You can do it even now, Lychee Peachy. You can do it even now. I always like your name, by the way. I told you last time. I really like the Lychee Peachy. I love Dr. Qazi so much. Please don't retire soon. I don't think I'm ever going to do like a full retirement like that. I would probably do more like I see my regular patients and see like mostly that type of thing. Like just finish up with that. Maybe if I want to do like some new patients here and there, we could do that. But mostly it'll just be like kind of the journey for like regular patients, honestly. That's kind of probably what I would end up doing. Like the patients that I see and like that I do, I love, honestly. And it's like, I would love just to like continue to grow and like with them and just kind of like always just like see what happens in their life, see how their face is changing, see what they enjoy, like and what they want to do and things like that. It'd be really, really nice to do that. That's kind of what I want to do actually. So it's like maybe more along, like not a full retirement. My dad, like he's not, I don't even know if he's going to retire. He's a cardiologist, but like he just keeps on, he loves working. And like he actually just relaxes when he does EKGs. I was like, on his Saturdays and Sundays, he's just like sitting there and like he's just like doing EKG and just like fun for him. And it's just relaxing. It's pretty cool actually. So it's like, do I really want him to like fully retire? It's like, it's great for him actually. It's like nice for him just to have that. And then of course the community aspect of it. I mean, you think it's kind of crazy actually, right? Like that, like some people are like that. I'm like that. It's like, actually it's pretty cool. Like I love life. I like doing like hanging out with my family, everything like that. But I also like just like expanding my mind and talking to people and like just seeing the journey of like other people. So all that makes you happy actually. So we'll keep that. What do you recommend for someone who breakouts with acne only on their cheeks and chin? Really interesting, actually, that a lot of my patients do have that exact problem a lot of time. And so you definitely want to make sure that you're doing things that are going to reduce oil production. So something like some sort of topical retinoid is probably the easiest thing to really potentially do. But if it's really breaking out, then you really consider something like a topical antibiotic and or an oral antibiotic. So usually though, just with some sort of retinoid, so that's probably like the easiest thing to do. Just get different gel over the counter, easy. So my day, you couldn't even get different. It was actually really hard to get different actually. It was like through a dermatologist and like sometimes they will like change like the retinoid on you and then it was like this big mess. When do you start seeing results with the cure? So really almost everybody's about 3 to 6 months out. Really, some patients say earlier than that, but like if you follow along, like people say, okay, yes, there's a difference at 3 months. There's a much bigger difference at 6 months. So much bigger. Do these scars happen over time? Yeah, these scars, a lot of times you may see that's like a smaller scar. It's not that big of a thing. And then something seems to have made it a little bit worse. Sometimes it's like just from like volume loss or fat loss underneath it that I was supporting and you didn't realize that I was getting worse. Sometimes a new cystic lesion just opens up right next to it and now it just gets destroyed a bit there. Let's see. Erie's saying are we booked until March? I think so. I know not the person responsible for like the bookings there at our office, but just always do the request through drqazi.com. I think it's in March, and I'm not sure if you're a current patient, but current patients we could boost up. We could try to boost up earlier the staff notes to try to put that in there for current patients, but new patients it may be a lot longer though. Someone's asking if you could treat their scars if they have silicone filler. Yes, I could. I actually did that recently on a patient. It's sometimes like really frustrating though with silicone filler though, because you may need to done subcision. Now you can't do subcision. And there's a lot of problems with silicone, and I think that's why the FDA put out that notice against silicone filler. And there's very few physicians who would do it. It's not even really off-label per se. It's just that the FDA has actually said don't use silicone filler. So it's like kind of risky in the first place. That it was done. You hope that there's not going to be any infection or anything you do now, anything like that too. That's another possible problem. But yes, we could do it. It's just, sometimes if it was like, it's really unfortunate if there was rolling scars that you could have broken up really effectively with subcision. Now you potentially can't because of silicone filler. Tanae saying, hi doctor, I'm considering getting a cure at your clinic. Do you recommend it for very mild hormonal acne? Maybe not so much for very mild hormonal acne. I mean, if you need something that's a long-term solution because you just have really severe hormonal acne or something like that, or moderate to severe hormonal acne, then yes, that makes sense. But very mild hormonal acne, there's a lot of other options that we could probably do, and a lot of times I recommend that actually. My patient last week, she actually was that category, and it was like she was actually, I think she had already gotten it, and I was looking at it, I was like, I think we just have to go slower, and because she was just not even on the right creams. It's like the creams that she was on, and I think she was sold it by like some clinic that or whatever, like online program that does acne, and she spent hundreds and hundreds of dollars on this thing, and it was just like so drying for her skin, and it was giving her exfoliants, like physical exfoliants, all that stuff. And so it's like I was like, let's get rid of all that stuff and like change a regimen, and then we could see if you really even need a cure. Because right now I'm not even convinced, because it may be just that the creams you're on were just bad. Maybe all that stuff was bad. That's partly why I like to tell you guys all this stuff, like what things to do. Because then if you do end up coming to me, it's like, we've already done all that part, and now we could talk more about doing procedures, because I like doing procedures. So it's like, you get all that under control first. And like, if you need, if we were going to work on your acne, you tried like the right things first, and then we could figure out how to do it. There was someone on here that was saying that she was ready to do a cure with me, and then she asked me a few questions about what things to do for her topical creams, and we changed some things, and now her skin's a lot better, she said. And she's like, fine, you're happy, awesome. And now it's like, you may not avoid it. We may have avoided scarring in you too. Because we treated your acne, we avoided your scarring. You avoided things like this happening. Yeah, that's awesome. Great. Most creative saying, drink water to avoid acne. Step number 1, face wash and moisturize if you need extra help. Actually, it's really true. So really good. Best night serum that is a must. Well, I would say just a tretinoin. Honestly, like a low dose tretinoin is probably the best, honestly. So vitamin A, the best thing you could possibly do for your skin. Going to book a virtual consultation, appreciate it. You just go on our page. You could do that. You could definitely just wait a little bit there for us the next day to schedule you in. My team will schedule you in. Why does it take many months to see results from a cure after the last session? It's it's shrinking the oil gland, and it's not an immediate effect, because it doesn't just like nuke it. There is a device that was out here a few years ago that would like kind of help bring like some actually gold into your oil gland and destroy the oil gland. And that was relatively like a faster result, but like it seemed like it could potentially cause more problems down the line. So that's why I never did it. But like the cure laser is like a slower process, because it doesn't just destroy it. It doesn't just like nuke that oil gland. It's just slow over time. Would you say a cleave is better than tretinoin? Yes, it's just very expensive, unfortunately. But yes, it is, I would say, a little bit less irritating. So I think that it's really nice also on the body. Interestingly enough, I have a lot of patients on it for the body acne, and sometimes we didn't really even need to do much with, we don't even have to do much else actually with the scars or anything like that. It just solves a lot of that. It was called sebaceous. I am Jaguar Paul says, Derm RN here. We saw no results with that laser. Yeah, that's unfortunate, right? Like that was an expensive treatment too. How is the pain with that, by the way? I think that they were, yes, she said, so I am Jaguar Paw is familiar with sebaceous, which was basically like putting gold into the oil gland. And they did come to me at one point, and it just didn't like the idea. She's saying that's so painful. Or he was saying it's so painful. I am Jaguar Power saying that treatment was so painful, and now the company's out of business. And it was like it's something that I thought would be like problematic for a lot of patients because they're giving them oil into that. Sorry, they're putting gold deep into their skin into the oil gland. And then like they're destroying the oil gland completely. I don't know. It just seemed like that could end up causing a lot more problems. And I never picked up that device because of that. And this is a lot different. This is a different technology. It's just targeting oil directly, only targeting oil. That's why it helps. That's why it's something that we could be a lot more comfortable with because it's not like just destroying it. It's not just like burning it. Thanks for the roses, by the way. Appreciate it. Actually, my patient today, a long-term patient, she actually brought me a really nice bracelet. I should start wearing it sometime. About Kimmy saying, hi, Dr. Qazi. Is there any way you could prescribe a topical if your chin breakouts aren't going away? Yes, just contact my office. You're an established patient, so we could hopefully try to see if we could set something up to help you out soon. And I am on for the next couple of weeks, though, so I'm not sure if you need it right away, but just contact us tomorrow. We can try to see what we could do. Erie saying, why would I have texture like if I was laying on a blanket without ever having acne? Good question, actually. I don't know why that would be the case. It's definitely oil production by itself is an inflammatory process. So that probably is an input that we're just seeing. Sometimes you can see like the pore size get a little bit larger because of oil production. But I don't necessarily know if that's the thing that is happening or if it's potentially like, when you're sleeping, you're getting friction on there. You could do silicone tape there. You can consider using silicone tape, actually. It could help with your texture, actually, from that, if it's due to friction. I'm getting a W is saying, I don't see subcision on your website, but you do that as well. I do a ton of it. I did 3 big subcision cases today. Really, really good cases, actually. I did 3 of those. So I do so much of it, actually. And I love it, actually. The price of it, though, the price is if it's not on our website because it just varies. It's like how thick the skin is, what we have to do with it, how much work is involved. And sometimes I undershoot it. That's fine. I'm still just going to do it for you and just get it done properly. All right, guys, I went way overboard because I had that technical issue earlier. I don't know, sometimes these platforms, even though it's almost 2025, sometimes there's like these technical things, but like at least we got back on. I'm glad we got to rejoin, and so many people were on here. Awesome questions, awesome things that you were asking. And so feel free to ask me some more, like by DM or anything like that. I'll try to go again. Well, I am going again tomorrow night. So that'll give us some good content, some new things to talk about too. So let me know what your thoughts were. Maybe Erie, your question, hopefully I'll get that